Hi friends, good evening. Once again, welcome back to my channel Mugambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam preparation. In the previous video, we discussed two set of previous year questions and answer, one set of previous year RRB questions and one set of previous year staff nurse grade 2 exam question paper. Today we can see important MCQ for exam. And the first question, which cranial nerve have the highest number of branches? Options, option A vagus nerve, option B facial nerve, option C trigeminal nerve, option D none of this. Our question, cranial nerve which have highest number of branches is vagus nerve. Option A is the correct answer. Vagus nerve has highest number of branches, so answer is option A, and it supplies to organs in head, neck, thoracic cavity, abdominal cavity and also pelvic cavity. And also another important point regarding vagus nerve is it is the longest cranial nerve and most extensive distribution of cranial nerve is vagus nerve. So the highest number of branches or extensive distribution of the cranial nerve is vagus nerve. Move on to the next question. The nerve supplied to jaw occurs by which nerve? Options, option A temporal nerve, option B ophthalmic nerve, option C maxillary nerve, option D zygomatic nerve. Nerve supplied to jaw occurs by maxillary nerve. Option C is the correct answer. Maxillary nerve is the branch of trigeminal nerve. Trigeminal nerve is the largest cranial nerve. It is the fifth cranial nerve. So this maxillary nerve is a branch of trigeminal nerve and it is a sensory nerve. Okay, maxillary nerve is a sensory nerve and it gets sensation from gums, teeth, upper jaw, upper lips and orbit. So here our question is, jaw is supplied by which nerve? It is maxillary nerve. And the next question, which of this nerve passes through the foramen magnum? Options, option A spinal nerve, option B vagus nerve, option C accessory nerve, option D hypoglossal nerve. Our question, among this option, which nerve passes through foramen magnum? And the correct answer is option C accessory nerve. Accessory nerve is the 11th cranial nerve. It's a type of motor nerve and its main function is swallowing. Here our question is the nerve which passes the foramen magnum. Foramen magnum is an opening in the occipital lobe. The nerve which goes to the foramen magnum is accessory nerve. Move on to the next question. Side effect of thiazides includes options, option A hypokalemia, option B hyperuricemia, option C hyperglycemia, option D all of this. Thiazides are diuretics. Okay. The main function of this thiazide diuretics are to increase sodium and water excretion. Our question is side effect of thiazides. The main side effect include decreases the potassium. Potassium decreases means hypokalemia, and hyperglycemia, that means it increases the glucose. Also hyperuricemia, that is increases the uric acid level. So all of this is the correct answer here. So the main side effect include hypercalcemia, hyperglycemia, hyperuricemia, hypokalemia and hyponatremia. Move on to the next question. Which of the following is an example of urinary antiseptic? Options, option A cresol, option B furosemide, option C nitrofurantoin, option D hypochlorite. Urinary antiseptic is mainly given to treat urinary tract infection. The main cause of urinary tract infection is Escherichia coli or E. coli. Here, among this option, nitrofurantoin is an example of urinary antiseptic. Option C is the correct answer. And the next question, birth weight quadruples by options, option A 5 months, option B 1 year, option C 18 months, option D 2 years. Here the question is, when did the birth weight of a baby become quadruples? Quadruples means it become 4 times. Okay, so here the correct answer will come option D by the age of 2 years. Normally at birth the weight of a newborn is normal weight of newborn is about 2.5 kg at birth. Then by the age of 5 months, it becomes doubles. At the age of 1 year, it becomes triples. That means 3 times. At the age of 2 years, it becomes quadruples. Quadruples means 4 times. That is our question. The birth weight quadruples at the age of 2 years. Then the birth weight increases 5 times at the age of 5 years, 6 times at the age of 6 years and 10 times at the age of 10 years. This is also important point. Move on to the next question. Nerve cells are not dividing because they do not have options. Option A, nucleus. Option B, centrosome. Option C, Golgi bodies. Option D, mitochondria. Here the question, nerve cells are not dividing or they are not having the power of regeneration because they are not having centrosomes. Option B is the correct answer. Option D, mitochondria is the powerhouse of the cell, and Golgi body, function of Golgi body is to help transportation and also packaging. Move on to the next question. Shape of thyroid lobe is. Options. Option A, spherical. Option B, butterfly. Option C, cone shape. Option D, cylindrical shape. Here the question is shape of thyroid lobe, not thyroid gland. Thyroid gland we know it is butterfly shape. The shape of thyroid lobe is spherical shape. Option A is the correct answer. Move on to the next question. Location and position of thyroid gland is. Options. T2 to T5. Option B, 5th, 6th, 7th cervical and first thoracic vertebrae. Option C, C7 and T2. Option D, T5 and T8. Question. Where is thyroid gland located and its position? So it is in between 5th, 6th, 7th cervical vertebrae and first thoracic vertebrae. So here the correct answer is option B. Move on to the next question. Name of the tongue bone is. Options. Option A, frontal bone. Option B, zygomatic bone. Option C, hyoid bone. Option D, mandible. Which is the tongue bone? And the correct answer is, it is hyoid bone. Option C. Related point we can see, sesamoid bone is known as patella, wing bone is known as scapula, shin bone is tibia, beauty bone is clavicle, tongue bone is hyoid bone.